Housing Task Force, Bentley and Diane Senholz.
Thanks for sticking with us, you two.
Yeah, sorry,
know.
I'm not a county employee, so I'm not used to my meetings going this late.
And our presentation is more of, what's happening in our community surrounding homelessness and near homelessness, so.
Yeah, we don't have a lot of opinions for you tonight. We just have a lot of facts. This is the work we've done. So if you can go ahead and you can skip the agenda slide, you can go to the next one. I want to be quick. It's like almost 10:30.
Yeah.
But this is a list of all the partners currently that are part of the Housing Task Force. And so to just be really brief about it, you've probably heard the Housing and Homelessness Coalition, you've heard of the Housing Task Force, you've heard of the North Central Continuum of Care, the Wisconsin Balance Estate. I've heard all of those things get thrown out. When I started at United Way, I was tasked to look at the Housing and Homelessness Coalition and find out if it was effective and ineffective. The answer to that was it was ineffective. The last thing that they had accomplished was opening the Wausau Warming Center, and that was 10 years prior to my starting. And so it was my recommendation that we dissolve the Housing and Homelessness Coalition and we create a more focused group. And the police department beat me to it. They started what's known as the Housing Task Force then. And then in working with Ben Bliven, he felt like United Way was the appropriate torchbearer to take that task force and really carry it forward. And so the Housing and Homelessness Coalition now resides in Diane's North Central Continuum of Care. And so anybody that was part of that coalition, we transitioned over to Diane's group that still meets quarterly. And the partners in the Housing Task Force are only meeting by invite. So you just can't come to a Housing Task Force meeting. You have to be invited, and the group actually votes on who we're going to admit to that task force. And that's in part to make sure that our objectives stay clear and that the group stays small and that we can be nimble and flexible to the community's needs. You can go to the next slide. So I'll give you just a quick recap. So this is just a recap of the January point in time count. So Diane hosts it. I lead the downtown team every year with the mayor. And in the 2023 January point in time count, it was 27 degrees. And so that was a rather warm point in time count for January. 16 unhoused individuals is what we came across, and that was mostly between my group, which was downtown, split with Tracy's group, which is the other downtown team. And so, and then shelters were near capacity, but neither one of them were at capacity that night. And then the rest, our prevention effort outlines here that I'll let Diane outline for you.
Yeah, I don't really need to go into detail, but our biggest efforts in this community with North Central Community Action Program are preventative efforts to homelessness. So these are just some stats. We rolled out the WERA program, the Wisconsin Emergency Rental Assistance Program. It's a COVID program. Before that, it was WRAP. So there's WERA 1, WERA 2. These are just WERA 2 numbers. So just here in Marathon County alone, we did help 283 households with $916,000. That's a lot of money. We kept a lot of people housed. Last year, we have our normal emergency housing assistance fund, which the United Way, I write that grant and the United Way funds it. We helped 240 households with $156,000. Now that program is really just a one-time assistance program where we could help people out for 18 months. But EHAF is really for people who are low income and they come across a crisis in their life, whether that be a medical crisis, a huge car repair, kids getting sick in the households. We want to be there for those families, those individuals who need that one-time rent assist, and then they're usually okay. So that's what EHAF is all about. HHP is a homeless prevention program, but that's a grant I write every year. It's a state grant, and we can house people from 3 months to 24 months. And to be eligible for that program, you just have to be on the verge of homelessness. You don't have to be homeless, but you have to have some mitigating circumstances as to why you are going to lose your housing. So that's a really wonderful program. We also have tenant-based rental assistance. That is a program much like Section 8 or HAP funding. That's where people can and we kind of reserve this for the families because it's really, really hard for families to get multiple months of housing. So TBRA helps a lot of our families in the area with several months of rent. And this program, so if they're working, they can pay 30% of their income towards the program, and we give that back to the state, or we actually reuse it in the program. So it's not like they're giving up, it's not like they're not paying their rent, but they're paying just 30% because we all know, I mean, I have very few clients that pay 30% of their income, household income in rent. It's always way more than that, 50 to 60 to 70%. And some people are okay with that. A lot of people can make it, but there's a lot that can't.
And then from a United Way perspective, between our emergency shelter programming, which we facilitate through the federal government, and then our funded partners, we fund about $356,000 a year in Marathon County initiatives. So that's between the Salvation Army, the Warming Center, Hope House Sober Living Program, things of that nature. And so all in, CAP in 2022 did about 1.2 million in the region, and then add in United Way funding, and we're sitting at about $1.6 million investment in just housing resources. I did want to go back to the previous slide and just leave that up there for a second. So that's just a snippet of some of the services that exist in the county. Most of those services are represented on the Housing Task Force as well. And so as we go into this next slide, though, I came into this conversation full well hearing the narrative that the county wasn't involved in any of these initiatives. And so before I let Diane kind of go into this program, the county also runs the Family Keys program, which I sit on the local coalition for that program, run through social services. I think Krista's here still. That program, like if you followed that at all through the county board, we had to really like drag that thing over the finish line. And so I do want to just take a moment and eliminate the narrative that the county is not involved in things, because the Family Keys program is a major initiative to keep children and their caregivers together, their parents together, especially to make sure that you're not losing custody of your children because of lack of housing, and that's a big deal in our county. And so when we think about what does county involvement look like, I don't want the base level to be, well, they're at 0 right now, because that's not the case. The county has active members on our housing task force that are there, part of those conversations. They were part of the conversations in the cold snap that we just recently had, that we had to, get beds together for, that we had to make sure that Salvation Army could expand their beds, make sure that Open Door was open. And so it's not necessarily a 0. And then we also wanted to just bring this up because this is a new program to our county that not a lot of people are aware of right now, but it is an example of something that should be scaled for the population in our county.
Right, so I want to talk about that because I think a lot of people, like Ben said, aren't aware that Marathon County is really, really involved. They've done a lot. In fact, they're champions in our state with regard to AODA programming and drug court, ODOBI court, a Justice Advisory Committee, and judges involved with the Justice Advisory Committee. I mean, they are champions, and we need to recognize that. They don't get enough credit because I think people aren't talking about it. And I really wanted to bring to light that, there is a problem with AODA issues and the chronically homeless. And Marathon County has supported the implementation of drug court and has worked with ADDIC for many, many years. And ADDIC, actually Department of Corrections, I think, bought the 80. It was like a CBRF on Bella Street. Doug, you know where that is. It was across from where your office used to be. So that's a very good program that's starting, and it can handle up to 18 Department of Corrections referred people with an AODA diagnosis. And currently they have 12 patients, but they can go up to 18. And those patients, they get 24/7, 365 care. So they are managed all around the clock, and that's a wonderful thing. During the day, they go to ADDIC for full-time day treatment services. That's huge, because that's going to really help those people get well. And that's what we want. So I wanted to bring that to light because a lot of people don't know about that. And Attic is also writing a grant, and it's pretty much, I think they're going to get the grant. I mean, it's pretty much a given, and it's a 5-year grant. And with that grant, they're going to do a street outreach with a street outreach team. So they'll have a caseworker, they'll have a peer support worker, they're going to have a recovery, a substance use and mental health counseling person to provide comprehensive services to the person wherever they are. And we're partnering with them because they want to work with some of our clients, because some of our clients aren't housed. So this new program is to actually go out, like I said, to where those people are and to start providing services and to wrap their arms around them, so to speak, get their trust, and when the time's right, roll them into housing. Like our programs that we have at our agency, we would love to have people who want to be in our housing programs, want the assistance to help them recover. We also run a permanent supportive housing program at our agency where it's housing first. So we house them, but we can't mandate any services. And I will tell you, there is a low success rate with that. I'm not saying that there isn't success, because there is, but it's a 40% can't even say the word, success rate. Yeah, it is late. But we do have that program here in Marathon County, and we started that program 3 years ago. It's much like Catholic Charities Beyond Shelter. That program is a wonderful program as well. So there's a lot of things happening to help these folks. I'm not saying that more shouldn't be done, but I just want you all to know that there's a lot being done. It's not a problem that started or that happened overnight, and it's not going to get fixed overnight. But we are working together. I mean, all of us work together daily.
And so when we talk about, the leverage of coalitions and task force, if you want to go to the next slide, in 2 short years, these are the 10 accomplishments of the Housing Task Force. So Tracy's position and the pilot program came out of the Housing Task Force. We streamlined the after-hour services program so that there was no more confusion about when you present after hours and there's no room for you at a shelter, what do you do? Where do you go? The Housing Task Force implemented the McClellan House. It's the first of its type in a housing first situation in the Wausau community, and it worked. And so when we think about things that worked, that are worth investing in, we think that's one of the solutions. We don't think it's the only solution, but it's definitely one of them. We know that it worked, and we'll see it later. But we simply lost the funding for it. That's what happened. And a re-implementation of that funding and a re-partnership with North Central Healthcare could put that program right back on track. We're currently working on implementing local case conferencing, which has never existed here. Any community that has ever done unhoused work correctly is doing weekly local case conferencing sessions. And so United Way has agreed to host those and facilitate them out of our building. But there's rules and regulations that come with them. There's certain confidentiality that comes with it. And we can't move forward until we have agreements in place with every provider that shows up. And so we're hoping end of April we can launch those case conferencing sessions. The big one is Diane and I both sat on the Affordable Housing Subcommittee that was created by the city, and we made the recommendations that were given to this body, and most of them were accepted. One of them including a $1 million investment or around that in affordable housing builds. And so that came out of the Housing Task Force. You notice the ongoing prevention efforts. I like to highlight that because when we talk about $1.6 million in prevention efforts, I would hate to see what our community looks like without those prevention efforts, without that investment. And so while, yes, there is a problem with the chronically homeless and we are wrapping our arms around it, we can't forget about the prevention efforts. The people who are almost homeless, but because of the services that exist here, we make sure that they never fall into that position. Recent win, we were the advocates and the idea of a 365-day shelter and the daytime servicing option that's now going to be run through Open Door both came out of the Housing Task Force. First time that the Wausau community has ever seen, a historic investment of $829,000 in that, but also either one of these services. And then we advocated and secured those ARPA dollars for the affordable housing investment. And then we continue to occupy seats on that affordable housing subcommittee to make sure that we're being heard and that we're having a say in that. 8 of those 10 accomplishments are brand new to this community. They've never been services that have existed here before. And so 4 of those 8 have not even had their feet touch the ground yet. The day center's been open for like 1 week, hardly, and we haven't even seen ground break on some of the affordable housing builds that we anticipate coming. And so, some of these things, somebody had said it up here. Some of these things are going to take a little bit of time to come to fruition, but they're in motion. And then just what our opinion on the gaps of services in, one, the McClellan House. We think we could have more McClellan houses. I hear and I agree with the more Tracy's. I like that idea, but where's Tracy supposed to go with some of these individuals right now? She's got to have a pipeline of services in place for these individuals to be able to access. Robust transitional housing services, and that means sobriety care as well. So one of the most successful agencies, again, a county-funded agency in our community, is Hope House Sober Living Program. I see the metrics on sobriety living programs every single 3 months, and nobody has the success rate like Hope House Sober Living does in this community. However, they have 1 case manager, and they can house 4 people at a time, 5. And sometimes those people take 5 to 7 years to get through the program, and so the bandwidth isn't there. I would call up North Central Healthcare right now and say, I'll throw money at you to be able to scale that to the size of our homeless population, because that's a tried and true method that we know works. And what works about it, it's the 24/7 wraparound care. It's having somebody there 24/7. And then one thing that we're really excited about is we're aware of this idea of people aren't going to the services. They're not going to the agencies. So every year I get a Medical College of Wisconsin intern assigned to me, and they work on a project for us. And this year, Riley, who maybe some of you have talked to or heard from, I know she's worked with some of our community partners out here, is going out and giving the unhoused population a survey directly to them. So it's the first time that we're going to have actual data from the unhoused population that says, why aren't you accessing services? And then we're going to use our influence with organizations like Catholic Charities, Salvation Army, to say they're not coming to shelter because of these reasons, and we fund you, so let's fix this. Because if people aren't coming to shelter because the rules are too strict or because they got a 10-day ban because they lined up 10 minutes early, that's unacceptable. And because we're a funder in the community, we can leverage that and say, we have to fix this, right? We have to find a solution to this because our services should be accessible to individuals. And so Riley is currently doing that right now. She is working with I know she's worked with Salvation Army already, with Catholic Charities. She's going to go out with Tracy and survey people out on the streets. And then when we get that data back, it can give us a little bit of an idea of why do our agency's services feel inaccessible to some of the people who need to receive them. And that's it. Do you have any questions? Sorry.
Oh.
Oh, we got a couple here. Okay.
Alder Denny?
Thanks, Madam Chair, and thank you, Ben and Diane. So more outreach case management, where would you envision those be located? I think there was a suggestion at one time that United Way was a more appropriate spot for some of this work than, say, the city.
You know, so again, it comes down to funding. I would argue that I'm in a worse funding position than anyone else is because I'm donor dollars, and donor dollars are limited. I can tell you, United Way wouldn't really have the bandwidth to house 5 outreach case managers right now. I don't have an opinion on where those people would exist necessarily. When we recommended Tracy's position, we recommended the position. It wasn't up to me where that position existed, or all that mattered was that it did exist and we could get it out there. And it ended up being at the police department for the pilot, and then it just worked there. So yeah, I don't necessarily have an opinion on, as a citizen, I would be like, where's that money coming from if it's
Well,
gonna be-
funding aside, I
Yeah,
guess I'm not suggesting that we burden you, but if there was it's been suggested there's better places for the, you know, like I suggested earlier, Tracy has her engagement, and at some point, we want her to hand that off
Yeah.
to a more permanent solution, and so that she
it's
can
on
keep
the-
on
Well, I
the
think,
trail.
I think